Hello, it's great to have you here. We're about to embark on a journey of knowledge together that I assure you is fundamental for your well-being and quality of life, especially when we think about longevity and how to live a full third age, old age, with independence. Often, due to shyness or simple lack of knowledge, we set aside topics that are crucial for our overall health. But hey, we're here to change that, to chat openly, like good friends sharing valuable secrets, understanding our body, how it works, and how to care for it through healthy habits, which include everything from good nutrition to regular exercise and keeping an active mind, isn't just a medical issue. It's the master key to achieving happiness and healthy aging. So, get ready, because we're going to unveil some fascinating and, believe me, very important aspects of male physiology, always with the goal of making you feel more empowered and in charge of your well-being. Don't forget to subscribe to the channel and comment from where it's coming from to appear in the next video. Today, my dear friend, we are going to delve into a topic that is sometimes whispered about, but which is vital for male health and, therefore, for our quality of life and happiness. The function of the prostate and everything surrounding the process of ejaculation. Hey, no need to blush or anything like that. On the contrary, knowledge is power, and understanding these mechanisms allows us to make better decisions for healthy aging and to maintain our independence for much longer. We will talk about how these processes relate to healthy habits, how they influence our overall health, and what we can do to promote our well-being. Forget the myths and half-truths. Here we are going to explore clearly and practically how this aspect of your physiology contributes to your longevity, and how maintaining an active mind and a healthy body is part of a whole. So let's get straight to the point, because there is much to discover to boost that vitality. Function of the prostate and semen composition. Let's start at the beginning, shall we? Let's talk about the prostate, that small but powerful gland, about the size of a walnut, located just below the bladder in us men. Often, we only hear about it when there are problems, right? But its function is crucial for reproductive health, and, in general, for male well-being. Its main task, and what a task it is to produce prostatic fluid. This fluid isn't just anything, no way. It's an essential component of semen, making up approximately 30% of its total volume. Think of it as a specialized factory that contributes vital ingredients. This knowledge is fundamental to understanding how healthy habits and caring for our body directly impact our quality of life and can promote healthy aging, allowing us to enjoy the third age, old age, with greater independence and happiness. Keeping an active mind also helps us process this information and make informed decisions about our health and nutrition, and even incorporate exercise as part of a full life that aspires to longevity. But be careful. The prostate doesn't work alone in producing semen. It's a team effort, as it should be. The seminal vesicles, other important glands, take most of the credit in terms of volume, producing a large portion of the seminal fluid, that vehicle that transports sperm. And speaking of the protagonists of fertility, the testicles, although they contribute only a small percentage to the total volume of semen, around 1%, their contribution is, of course, fundamental, the sperm themselves. So as you can see, it's a symphony of organs working in harmony. Understanding this collaboration helps us appreciate the complexity of our organism and the importance of caring for it comprehensively to ensure our health and well-being. Healthy aging largely depends on how we treat our body throughout life, adopting healthy habits that promote longevity and allow us to maintain independence and happiness in the third age, old age. Good nutrition and constant exercise are pillars, along with an active mind, for an excellent quality of life. Now, let's delve a little deeper into that prostatic fluid we were talking about. It's not simply water, not at all. It's a complex and rich mixture of nutrients and specific substances that perform vital functions. Among its components, we find zinc, which is very important for sperm health, citric acid, which helps liquefy semen after ejaculation, acid phosphatase, a characteristic enzyme, and other diverse enzymes. And of course, we can't forget the famous PSA, prostate-specific antigen. The latter is a protein that helps keep semen liquid, facilitating sperm motility, and is also the marker used in blood tests for the early detection of possible prostate problems. Knowing this composition gives us an idea of how sophisticated our body is, and how every detail counts for our reproductive and general health. Fostering healthy habits is, in essence, taking care of these complex functions to ensure our well-being, a good quality of life, and active longevity, full of happiness and independence even in the third age, old age. Exercise, a balanced nutrition, and an active mind are key in this process. If you're liking this information, give it a thumbs up so we know we're on the right track. Ejaculation process. All right, now that we have a better understanding of what semen is composed of and who the main players in its production are, it's time to talk about the ejaculation process itself. Hold on tight. It's fascinating. This process isn't as simple as pressing a button. It's a perfectly coordinated choreography that is broadly divided into two main phases. The first is the emission phase. Imagine it's like the preparation before the big launch. The fluids produced by the prostate and seminal vesicles, along with sperm from the testicles, begin to accumulate in the prostatic urethra, which is the part of the urethra that passes through the prostate. This accumulation occurs in a very specific space between the internal sphincter of the bladder, which closes so that semen doesn't go backward, and the external sphincter. This first step is crucial to ensure everything is ready for the second phase, and it's a wonderful example of how our body works to achieve reproductive health, an important component of our overall well-being and quality of life. Caring for these mechanisms with healthy habits contributes to healthy aging and maintaining independence and happiness throughout longevity, even in the third age, old age. Nutrition, exercise, and an active mind play their part here. After the emission phase comes the expulsion phase, the grand finale. Once the semen has accumulated and is ready, something wonderful happens. The external sphincter, which was closed, relaxes. But that's not all. Almost simultaneously, the perineal muscles, which are the muscles at the base of the pelvis, begin to contract rhythmically and powerfully. It is these contractions that propel the semen through the urethra to the outside. Pure physics and biology in action. This whole internal ballet, from the production of components to their expulsion, depends on flawless integration between the nervous system, which gives the orders, and all the genital structures involved, which execute them. It's an example of the precision with which our body is designed, a system that seeks to maintain health and well-being. Adopting healthy habits is a way of respecting and supporting this perfect machinery, aiming for longevity with quality of life, independence, and happiness, especially upon reaching the third age, old age. Exercise, good nutrition, and an active mind are our allies. What do you think of this coordination? Leave us a comment with your thoughts. Impacts of ejaculating infrequently. Now that we've broken down how the whole prostate and ejaculation system works, a question arises that many ask themselves quietly. What happens if one doesn't ejaculate very often? Does it have any impact on health? Well, let's lay our cards on the table. Directly, there are no conclusive studies saying that ejaculating infrequently causes serious diseases as such. However, and here comes the important but, a lack of regular ejaculatory frequency could indeed have its issues, especially if certain prostatic conditions already exist. For example, it's thought that the accumulation of semen, or rather prostatic secretions, could aggravate symptoms in men already suffering from problems like prostatic congestion or local inflammation. Imagine a river that doesn't flow energia enough. Over time, the water stagnates, right? Something similar could happen on a small scale, affecting well-being and quality of life. Maintaining healthy habits and being attentive to these signs is key for healthy aging and for enjoying the third age, old age, with independence and happiness. Longevity isn't just about living longer, but living better, and for that, an active mind, good nutrition, and exercise are fundamental. One point that does have more evidence is the relationship between low ejaculatory frequency and chronic bacterial prostatitis, an inflammation of the prostate caused by bacteria that can be quite bothersome and persistent. It seems that not cleaning the pipes regularly could worsen this condition. In fact, there's a rather revealing study, although it's a bit dated now, from 1999, imagine, that showed something very interesting. In men with chronic prostatitis, increasing the frequency of ejaculations, whether through sexual intercourse or masturbation, significantly improved symptoms. There you have it. This suggests that regular sexual activity, including ejaculation, could be part of the healthy habits that contribute to prostate health and, therefore, to overall well-being. This is especially relevant when we think about long-term quality of life, about healthy aging that allows us to enjoy the third age, old age, with independence and happiness. Longevity with vitality is the goal, and for that, nutrition, exercise, and an active mind are our great travel companions. If this topic seems important to you, consider subscribing to the channel so you don't miss more valuable information about your health. Other benefits of ejaculation. But wait, there's more. The benefits of an active sex life that includes ejaculation are not limited just to prostate health. Not by a long shot. It turns out that maintaining a healthy frequency of ejaculations can have a positive impact on other areas of our well-being and quality of life. One of the most surprising, and one that will surely interest you, is sleep quality. Yes, you heard that right. Recent studies from 2023 have begun to shed light on this topic, indicating that both sexual intercourse and ejaculation just before going to bed can significantly improve both the ease of falling asleep and the overall quality of sleep, and this applies to both men and women. It seems that the release of certain hormones and the relaxation that follows orgasm prepare the body and mind for restful sleep. This is a perfect example of how certain healthy habits which we might not have directly associated with rest can greatly contribute to our happiness and healthy aging. Pillars for enjoying the third age, old age, with independence and vitality, aspiring to greater longevity. Good nutrition, exercise, and an active mind complement this picture of well-being. This finding about sleep is really interesting, don't you think? Think about how many people struggle to sleep well. If something as natural as sexual activity can help, well, it's most welcome. It's another piece in the puzzle of healthy habits that contribute to a better quality of life. Happiness and general well-being are nurtured by these small, great discoveries. And, ultimately, enjoying good health is not just the absence of disease but a state of physical and mental balance. Maintaining an active mind, proper nutrition, and regular exercise are fundamental, but so are these more intimate aspects of our physiology. Everything adds up for healthy aging, for living the third age, old age, with independence and joy, and for achieving that longed-for longevity with fullness. So, in addition to its reproductive functions and its possible role in prostate health, ejaculation could be an unexpected ally for your nights of rest. Don't forget to like this video if you find this information on how to improve your well-being useful. Ejaculation and prostate cancer. Risk. Now, my dear friend, we come to a point that has surely crossed your mind and is of vital importance when we talk about prostate health and longevity. The relationship between ejaculation frequency and the risk of developing prostate cancer. And here, the news can be quite encouraging. Various epidemiological studies, those that follow many people for years, have investigated this connection. One of the largest and most cited, pay attention to this, followed more than 30,000 men for almost 20 years. And what did they find? Well, something that makes us think. Those men who reported ejaculating 21 times or more per month had a significantly lower risk of developing prostate cancer compared to those who only did so 4 to 7 times a month. A noticeable difference. This is a clear indication of how certain behaviors, which we can consider part of our healthy habits, could directly influence our well-being and quality of life, especially thinking about healthy aging and how to live the third age, old age, with greater independence and happiness. Keeping an active mind to process this information is key. The interesting thing about this mega-study is that the protective effect was observed whether the ejaculations came from sexual intercourse or were the result of masturbation, so the origin didn't seem to matter as much as the frequency. Furthermore, the benefit was especially clear for prostate cancers considered low risk, which are, fortunately, the most common. But this isn't an isolated finding, huh? Other more recent studies from 2017 and 2018, as well as various meta-analyses, which are studies that combine the results of many investigations, have confirmed this association, especially in men in the 30 to 40 age group, a crucial period for long-term health. All this reinforces the idea that regular sexual activity could be a protective factor, one more component of those healthy habits we seek to promote our well-being, improve quality of life, and ensure healthy aging that allows us to enjoy the third age, old age, with independence, happiness, and greater longevity. Of course, good nutrition and exercise remain pillars. However, as a good mentor, I have to show you the whole picture, with its highlights and shadows. Although, these results are very promising and give us important clues on how to care for our prostate health, it's crucial to mention the limitations of these studies. Most are based on retrospective questionnaires, meaning participants are asked about their past habits, sometimes from many years ago. And of course, memory can play tricks on us, or habits may have changed over time. This introduces a margin of error that somewhat limits the precision with which firm recommendations can be made. Nevertheless, the observed trend is strong enough to be seriously considered as part of a lifestyle that promotes well-being and quality of life. It's always good to supplement this information with healthy habits like a balanced nutrition, regular exercise, and maintaining an active mind, all focused on healthy aging, independence in the third age, old age, happiness, and longevity. What do you think about these studies? Share your opinion in the comments. Possible protection mechanisms. So, if ejaculating frequently seems to be good for reducing the risk of prostate cancer, the next logical question is, why? What are the biological mechanisms that could be behind this protective effect? Well, science has some very interesting hypotheses. One of the most accepted ideas is that of house cleaning. It is believed that frequent ejaculation could help eliminate potential carcinogenic substances or toxins that may have accumulated in the prostate and seminal vesicles from the body via semen. Think of it as a regular flush that reduces the contact time of these potentially harmful agents with prostate cells, thus minimizing the risk of them initiating a cancerous process. This is a very intuitive mechanism that highlights how a natural body function can contribute to health and well-being, fostering longevity with quality of life. Adopting healthy habits in all aspects, from nutrition to exercise and maintaining an active mind, complements this natural protection for healthy aging and greater independence and happiness in the third age, old age. Another protective pathway could be related to hormonal regulation. Yes, hormones always meddling. Ejaculatory frequency could influence the balance of important hormones like testosterone, dihydrotestosterone, DHT, which is a more potent form of testosterone, and estrogens. These chemical messengers play a crucial role in the growth and function of prostate cells, and an imbalance in their levels has been associated with an increased risk of tumor development. Therefore, if ejaculating regularly helps maintain this delicate hormonal dance in harmony, it could be contributing to slowing down processes that favor cancer. It's another example of how our lifestyle and healthy habits can have a profound impact on our health at a cellular level, promoting well-being, a better quality of life, and healthy aging that allows us to enjoy the third age, old age, with independence, happiness, and greater longevity. Don't forget that nutrition, exercise, and an active mind are your great allies in this task. And it doesn't end there. There are more potential heroes in this story. It is speculated that sexual activity, and therefore ejaculation, could strengthen the immune system. A fit immune system is like having an army of watchmen constantly patrolling our body, ready to detect and eliminate abnormal or potentially cancerous cells before they have a chance to become a full-blown tumor. So a little boost to our defenses never hurts. Furthermore, we cannot forget the reduction of inflammation and oxidative stress. The muscle contractions that occur during ejaculation improve blood flow in the pelvic area, which can help reduce local inflammation. And, as if that weren't enough, it could also reduce oxidative stress in prostate cells, which is that cellular damage caused by free radicals, implicated in aging and many diseases, including cancer. As you can see, there are several fronts on which frequent ejaculation could be playing in our favor, contributing to health, well-being, quality of life, and preparing the ground for healthy aging, greater independence and happiness in the third age, old age, and full longevity. Subscribe if you want to keep learning about how to naturally boost your health, prostate surgeries and consequences for ejaculation. Now, my dear friend, we must touch on a subject that, although it may be a bit more delicate, is fundamental to know, especially if the need for prostate surgery ever arises. Whether due to benign growth or cancer, these interventions can have direct consequences on ejaculation and, therefore, on quality of life and sexual well-being. Let's start with surgery for benign prostatic hyperplasia, BPH, which is that common enlargement of the prostate with age that can cause urination problems. In this type of surgery, what is done is to remove only the prostate tissue that has grown excessively, the heart of the prostate, so to speak, but the outer capsule is preserved. A very frequent consequence of this intervention is so-called retrograde ejaculation. What does this mean? Well, although the man continues to have orgasms and generally erections, the semen, instead of being expelled outwards through the urethra, goes backward towards the bladder and is then eliminated with urine. It is not dangerous for health, but it is a significant change in the sexual experience that can affect happiness and the perception of healthy aging. It is vital to be informed to face it with an active mind and seek the necessary support to maintain emotional independence. The situation changes quite a bit when we talk about surgery for prostate cancer, known as radical prostatectomy. The name itself tells us a lot. Radical means that the prostate is completely removed, along with the seminal vesicles. Then, the surgeon has to reconnect the urethra directly to the bladder. As you can imagine, an intervention of this magnitude has significant consequences. The most direct and obvious is the total loss of ejaculation, as the organs that produce most of the semen have been removed. There's no way around that. Furthermore, this surgery carries significant risks of two other sequelae that can strongly impact well-being and quality of life: urinary incontinence and erectile dysfunction. This is because very close to the prostate pass nerves and structures fundamental for urine control and for erection, and sometimes it is inevitable that they are affected, or even that it is necessary to remove them if the cancer is very widespread. Facing these changes requires a lot of strength, support, and healthy habits for recovery. Thinking about adapted healthy aging and seeking possible happiness and independence in the third age, old age. But cheer up. Not everything is gloomy in this picture. Medicine is advancing by leaps and bounds, and in recent years, much more precise and less invasive surgical techniques have been developed, such as robotic surgery. These techniques allow the surgeon to work with an enlarged view and with very delicate instruments, which in many cases makes it possible to preserve those important nerves responsible for erection and improve urinary continence control. While ejaculation as we knew it before a radical prostatectomy is not recovered, the possibility of maintaining erectile function and good continence greatly improves the prospects for quality of life and well-being after cancer treatment. This is crucial for the patient's emotional health, for their happiness, and for maintaining a degree of independence in their intimate life. It is a path that requires patience, rehabilitation, and above all, the support of professionals and the promotion of healthy habits that help in recovery and in the process of healthy aging, even after overcoming such a serious illness, focusing on longevity with the best possible quality of life and maintaining an active mind. If you know someone who has gone through this, send them this video. It might be helpful. Recommendations and care. At this point, after this whole journey through prostatic physiology, ejaculation, and its implications for health, you're surely wondering, well then, what's the magic number? How many times should I ejaculate to be healthy and happy? And that's a very valid question. But the answer, my friend, is not as simple as giving a figure, despite studies suggesting benefits. With frequencies like 21 times or more per month to reduce the risk of prostate cancer, the truth is that there is no official medical recommendation establishing a minimum or maximum mandatory frequency of ejaculation. There's no one-size-fits-all recipe. Longevity and well-being are not built with fixed numbers, but with a deep understanding of our own body and our needs. Cultivating healthy habits is a personal journey, and sexual frequency is just one more piece of that great puzzle that is our quality of life. Healthy aging is based on adaptation and self-knowledge, seeking happiness and independence in the third age, old age, with an active mind. The ideal frequency of ejaculation is something very personal and depends on a constellation of factors. Your age, your general state of health, your emotional state, very important, your daily routine, your levels of sexual desire, whether you have a partner or not, everything influences it. What may be perfect and healthy for one person might not be for another. Therefore, rather than obsessing over a number, What is truly crucial for your well-being and quality of life is to focus on prevention and comprehensive self-care. And this is where the pillars of healthy aging come into play with all their strength. Maintaining healthy habits such as not smoking, eating a balanced and varied nutrition, avoiding obesity and a sedentary lifestyle, and, fundamentally, undergoing regular medical checkups for the early detection of prostate cancer and other health problems. These are the true secrets to a full longevity, full of happiness and independence, especially when navigating the third age, old age. Exercise and keeping an active mind are your best allies. And please be very careful with the information floating around out there. In the internet age, it's very easy to fall into the trap of miracle diets, magic supplements, or home remedies that promise to prevent prostate cancer or cure all ills. Don't be fooled. Science is clear. There are no such shortcuts. True prevention and care for your prostate and general health lie in a constant commitment to the healthy habits we've already mentioned. Good nutrition, exercise, not smoking, controlling weight, and, above all, regular medical follow-up. This is the path to lasting well-being, optimal quality of life, healthy aging that allows you to enjoy the third age, old age, with independence and happiness, and achieve active and full longevity. Keep an active mind and be critical of the information you receive. In conclusion, my dear friend, ejaculating with some frequency seems to have its benefits for prostate health, potentially improving symptoms of some conditions, and even, as we've seen, reducing the risk of cancer. However, there is no fixed rule set in stone. What is fundamental, what truly makes a difference, is that set of healthy habits, medical support, and understanding that each organism is a world of its own, especially when facing situations like prostate surgery. Each case is unique and deserves personalized attention.